As a result of our initial discussions with the National Centre for Social Marketing, we embarked on a scoping exercise that actually looked at the take-up of services in the area in more detail, that gathered information from health professionals and others that were working in the area about the actual smoking behaviour in the area and the actual take-up of services and people's response to the use of services. We felt that the services that we offered satisfied the need of some people in Brinnington, but they obviously weren't satisfying the need of the majority of the people who lived in the area. So we decided that we would concentrate and focus our efforts around an estate in the north of the Brinnington and Central Ward, the Brinnington estate, which is approximately 6,000 adult residents, and 54% of those adults smoke. So approximately 3,000 smokers, of whom a very small number were using smoking cessation services. For example, last year there were only 163 registrations from the Brinnington estate for use of smoking cessation services. We had probably about a week at the most of examining what we already knew about smoking cessation support in the Brinnington area. We obviously drew on health stats that, being in the Public Health Directorate, were relatively easy for me to get hold of. So we knew about the health status of the population, the relative level, the high level of deprivation, and we knew about people's access to services generally, like the population using the GP practice, for example. We then started to look at the views of health professionals that were relatively easy to contact by telephone. So we asked the existing Stop Smoking service staff. We went to interview a health visitor from the area, and so brought that together into a document that would help us sort of get a deeper understanding. We did actually look at initiatives that were going on in other parts of the country as well, again just by reading the literature that was available and following leads. If we knew through the Smoking Cessation Network that there was a project going on in another part of the country, we approached those leads and just had telephone conversations to try and get a sense of what possible directions might a new service design take us in. Our first phase of primary research was to hold 5 focus groups in Brinnington. They were mixed gender groups, and the people that came were of different ages, and we had 5 segments. We had hardened smokers who had no intention of stopping smoking. We had people who were smoking but were thinking of stopping smoking, or who would like to stop smoking. We had people who had made an attempt to stop smoking and been successful. We had people who were currently in the process of stopping smoking, and finally we had people who had made an attempt to stop smoking but had not been successful in the past. Obviously, you know, smoking is very much ingrained in some communities, that it's very challenging to stop smoking because of the addiction, and also the social norm being that you can sit with friends and enjoy a cigarette together, and that sort of moving away from that can actually be quite isolating. From our primary research, we knew that we needed to target men and women with younger children. So we embarked on a second phase of research and held a number of focus groups where we invited men and separately invited women with younger children to talk to us about their aspirations for stopping smoking, to talk about their fears, the pressures to stop and the pressures to remain a smoker, and to give us some insight into the types of services that might enable them to stop smoking. From our phases of research, we realised that the key motivations for stopping smoking and the barriers to stopping smoking were largely the same as already seen in national research. But we found that there were specific issues that people in Brinnington felt strongly about. For example, people felt that they were being nagged at by health services to stop smoking. That's not particularly coming from the local services, but more to do with the general sort of fact that there's smoking cessation messages on the television. It actually goes broader than smoking cessation. It relates to a sort of a whole sort of bombardment by the media around health messages. So healthy eating, even sort of, you know, as far as taking job opportunities. A lot of public service messaging directed at the people in a priority area in order to influence their behaviour. There was a sense of distrust or perhaps reticence about engaging with people who were seen as coming from outside of the community. And by outside I mean people that didn't live in the community or perhaps hadn't worked there for a number of years and built up a trusted relationship with the people who live in the community. People were keen to stop smoking, but they wanted to do it very much on their terms.